Does sleep apnea cause restless leg syndrome? If you're struggling with restless legs and sleep apnea, you might be wondering if there's a connection between the two. Let's break it down to understand whether sleep apnea actually causes restless leg syndrome. First, let's look at what each condition is. Restless leg syndrome, or RLS, is a neurological disorder that makes you feel an intense urge to move your legs, especially at night. It can be really uncomfortable and disrupt your sleep. On the other hand, sleep apnea is a condition where you stop breathing for short periods during sleep, which can also affect the quality of your sleep. Now, the question is, do these two conditions have a link? Research shows that people with obstructive sleep apnea, OSA, are more likely to suffer from RLS. One study found that about 8.3% of people with sleep apnea also had clinically significant RLS, which means they experienced symptoms at least 2 to 3 days a week. In contrast, only about 2.5% of the control group without sleep apnea had RLS symptoms. However, having sleep apnea does not directly cause RLS. Instead, both conditions can coexist and influence each other. For example, the poor sleep quality caused by sleep apnea can exacerbate RLS symptoms. Additionally, certain habits like drinking alcohol, smoking, and consuming caffeine can make both conditions worse. Treating sleep apnea can actually help with RLS symptoms. Using a CPAP, continuous positive airway pressure machine to treat sleep apnea has been shown to reduce RLS symptoms in many patients. In fact, over half of the patients using CPAP were able to reduce their medication for RLS. Good sleep hygiene is also crucial for managing both conditions. This includes sticking to a regular sleep schedule, creating a dark, quiet, and cool bedroom environment, and following a relaxing bedtime routine. Avoiding electronic devices an hour before bed can help your brain produce melatonin, the sleep hormone. So, while sleep apnea does not directly cause restless leg syndrome, they are connected in the sense that they can both affect sleep quality and exacerbate each other's symptoms. By addressing sleep apnea and maintaining good sleep habits, you can help manage both conditions and get a better night's sleep.